Welcome. Today we're diving into a fascinating and sometimes concerning topic: athlete's heart. This condition highlights the remarkable adaptability of the human body, while also raising important questions about cardiac health in athletes. Join us as we explore what athlete's heart is, how it develops, and what it means for those who push their bodies to the limit. Athlete's heart isn't a disease in itself, but rather a constellation of physiological changes that occur in response to sustained and intense physical training. The primary cause is the repetitive and significant cardiovascular workload imposed by endurance and strength-based sports. Think long-distance runners, cyclists, swimmers, and even weightlifters. These athletes consistently demand that their heart pump more blood to meet the needs of working muscles, triggering a cascade of adaptations. The pathophysiology of athlete's heart involves structural and functional remodeling of the heart. Over time, the heart muscle, or myocardium, undergoes hypertrophy, meaning it gets thicker. This is primarily eccentric hypertrophy, where the left ventricle, the heart's main pumping chamber, increases in size to accommodate a greater volume of blood. There can also be concentric hypertrophy, where the heart wall thickens without significant chamber enlargement, particularly in resistance athletes. These changes are accompanied by an increase in stroke volume, the amount of blood pumped with each beat, and a decrease in resting heart rate. The heart becomes more efficient at delivering oxygen to the body, even at rest. The exact prevalence of athlete's heart is difficult to pinpoint, as diagnostic criteria vary and many athletes are asymptomatic. However, it's generally accepted that the condition is more common in endurance athletes, with some studies suggesting it can affect up to 50% of elite endurance athletes. It's less prevalent in resistance athletes but still occurs. The condition also seems to be affected by sex, age, and ethnicity, with men being affected more than women, and younger athletes more susceptible to the changes. It's important to remember that athlete's heart is a spectrum, with the degree of remodeling varying based on training intensity, sport type, and individual genetic factors. In many cases, athlete's heart is asymptomatic. The individual feels healthy and performs at a high level. However, some athletes may experience symptoms such as fatigue, lightheadedness, or shortness of breath, particularly during exercise. These symptoms can overlap with those of more serious cardiac conditions, making accurate diagnosis crucial. Palpitations can also occur. It's important to note that any unexplained cardiac symptoms in an athlete should be promptly evaluated by a healthcare professional. Diagnosing athlete's heart involves a thorough clinical evaluation, including a detailed medical history, physical examination, and various diagnostic tests. An electrocardiogram, or ECG, can reveal characteristic changes such as bradycardia, or a slow heart rate, and voltage criteria for hypertrophy. An echocardiogram, or ultrasound of the heart, provides detailed images of the heart's structure and function, allowing for assessment of chamber size and wall thickness. Exercise stress testing can evaluate the heart's response to exertion. Cardiac MRI is sometimes used to provide more detailed imaging and differentiate athlete's heart from other conditions, particularly hypertrophic cardiomyopathy. While athlete's heart is not strictly classified into types, there are subtle variations in the cardiac remodeling that can occur based on the type of sport. Endurance athletes tend to exhibit more eccentric hypertrophy, while resistance athletes may show more concentric hypertrophy. Also, some athletes might experience only eccentric hypertrophy, whereas others might experience both eccentric and concentric. However, in all athletes, both types of hypertrophy can occur at the same time. Athlete's heart typically does not require treatment, as it is a physiological adaptation to training. However, careful monitoring is essential to differentiate it from potentially dangerous cardiac conditions. If symptoms are present, a period of detraining or reduced training intensity may be recommended to see if the cardiac changes reverse. In rare cases, if there is concern about underlying heart disease, further investigations and treatment may be necessary. The focus is on ensuring the athlete's safety and preventing sudden cardiac death. Preventing potential complications related to cardiac remodeling in athletes involves careful screening and monitoring. Pre-participation screening with history and physical exam is important. Awareness of family history of sudden cardiac death or inherited heart conditions is paramount. Gradual increases in training intensity, adequate rest and recovery, and avoiding performance-enhancing drugs are all crucial for promoting cardiac health. Athletes should be educated about the symptoms of potential cardiac problems and encouraged to seek medical attention if any concerns arise. The prognosis for athletes with athlete's heart is generally excellent. In most cases, the cardiac changes are benign and reversible with detraining. However, it's crucial to differentiate athlete's heart from other, more serious cardiac conditions that can increase the risk of sudden cardiac death. Recent research is focusing on developing more refined diagnostic criteria to distinguish athletes' heart from conditions like hypertrophic cardiomyopathy. Genetic testing may also play a role in identifying individuals at higher risk for adverse cardiac events. Further research is needed to fully understand the long-term effects of athletes' heart and optimize screening and management strategies for athletes.